And in this podcast, I'm continuing my review of the bones and bony landmarks of the appendicular skeleton. And our focus today is on the bones that make up the pectoral or shoulder girdle. This includes the clavicle or collarbone and the scapula or shoulder blade. The pectoral girdle is where the humerus, which is the upper arm bone, attaches to the axial skeleton. The clavicle is the anterior bone of the pectoral girdle, and it articulates with the manubrium, which is the superior portion of the sternum, to form the sternoclavicular joint. The scapula is the posterior bone of the pectoral girdle, and it articulates with both the clavicle and the humerus. It articulates with the clavicle to form the acromioclavicular joint, and with the humerus to form the glenohumeral or shoulder joint. The bones of the pectoral girdle are held in place and stabilized by muscles, such as the levator scapulae and rhomboids that have attachments with the vertebral column. Okay, let's examine the clavicle. The clavicle is a small, narrow bone that has a pronounced S-curve. It sits horizontally across the anterior thorax, just superior to the first rib. You can easily palpate the clavicle because it's found just under the skin, and it helps transmit force from the arm to the trunk. When viewed in the anatomical position, the medial half of the clavicle is convex anteriorly, which means that the bone curves towards you, and the lateral half is concave anteriorly, which means it curves away from you. The middle region of the clavicle, where these two curves meet, is the weakest point of the bone. And not coincidentally, it's the most frequent fracture site. The sternal end or extremity of the clavicle is the more rounded and thicker medial end. This is the end that articulates with the manubrium of the sternum to form the sternoclavicular joint. The acromial end or extremity of the clavicle is the flatter, broader, lateral end of the bone. It articulates with the acromion of the scapula to form the acromioclavicular joint. The conoid tubercle is an inferior bump on the surface of the clavicle's lateral end. It's the attachment point for the conoid ligament, which connects the clavicle to the scapula. Okay, let's take a closer look at the scapula. This is a large, flat, triangular bone that's located posteriorly in the superior thorax, between the second and seventh ribs. The spine of the scapula is a large diagonal ridge running across the posterior surface of the bone. You can feel the spine by running your fingers along the back of your shoulder. And this is a great landmark to differentiate the posterior and anterior sides of the bone. The acromion is a flat process that extends away from the lateral end of the spine. It resembles the head of a golf club. The name acromion refers to its topmost location on the shoulder. It's the highest point that's easy to palpate. And as stated earlier, it articulates with the acromial end of the clavicle to form the acromioclavicular joint. The glenoid cavity, or fossa, is a shallow depression found just inferior to the acromion. This is where the head of the humerus articulates to form the glenohumeral, or shoulder joint. The medial, or vertebral border, is the thin edge of the scapula closest to the backbone. The lateral, or axillary border, is the thicker edge closer to the arm. The inferior angle is where both the medial and lateral borders join together. The superior border is the superior edge of the scapula, and the superior angle is where both the superior and medial borders join together. The scapular notch is a small indent on the superior border, which allows passage of the subscapular nerve. The coracoid process is an anterior projection found at the lateral end of the superior border. The word coracoid means crow-like, which is a reference to the shape of the bone, which is said to resemble the head and beak of a crow. But I think it looks more like a crooked finger. It serves as an attachment point for ligaments and tendons of muscles of the arm and thorax, including the pectoralis minor, coracobrachialis, and biceps brachii. The supraspinous fossa is a groove located superior to the spine. It's an attachment point for the supraspinatus muscle of the shoulder. The infraspinous fossa is located just inferior to the spine, and it also serves as an attachment surface for the infraspinatus muscle of the shoulder. The subscapular fossa is a broader, slightly hollowed out region on the anterior surface of the scapula that serves as an attachment point for the subscapularis muscle. And that will conclude our review of the bones and bony landmarks of the pectoral girdle. I hope you're finding these podcasts helpful in your study of skeletal anatomy. Thanks a lot for watching, as well as for your wonderful feedback. I enjoy hearing from my viewers all over the world. I'll be posting more podcasts regularly from now through the summer. So until next time, bye. Hello, this is Rob Swatsky from the York campus of Harrisburg Area Community College in York, Pennsylvania. And in this podcast, I'll be continuing my review of the bones of the appendicular skeleton, focusing on the bones of the arm, specifically the location and surface landmarks of the humerus. The humerus is the upper arm bone in the brachial region, and it's the largest and longest bone of the arm. It articulates with the scapula on its proximal end and with the radius and ulna on its distal end to form the elbow joint. Okay, let's take a look at the bony landmarks at the proximal end of the humerus. This is the head, the rounded portion that articulates with the glenoid cavity of the scapula to form the shoulder joint, also known as the glenohumeral joint. A great way to identify the left humerus from the right humerus is the orientation of the head. It always points medially towards the scapula. The oblique groove just distal to the head is the anatomical neck. This is the remnant of the epiphyseal growth plate that was once active in the growing bone. The greater tubercle is a lateral projection distal to the anatomical neck. You can feel this bump if you palpate on the lateral side of your shoulder area, just inferior to the acromion of the scapula, which is also palpable. The lesser tubercle is the anterior projection just inferior to the anatomical neck. The intertubercular sulcus is the groove found between the greater and lesser tubercles. Just distal to the tubercles is the surgical neck, a narrow area of the humerus where the head tapers to the shaft. It is so named because this is the common site of fractures to the humerus. The body or shaft is more cylindrical at the proximal end of the bone, then becomes more triangular, and then takes on a broader and flatter shape towards the distal end. Located at the middle of the shaft on its lateral side is a rough V-shaped region called the deltoid tuberosity. This is an attachment point for the tendons of the deltoid muscle. The radial groove is a depression on the posterior humerus that runs alongside the deltoid tuberosity and contains the radial nerve. We can also find several distinct bony landmarks at the distal end of the humerus. The capitulum is a round, knob-shaped process on the lateral aspect of the bone. Caput means head, and you can remember this part because the capitulum is curved. The capitulum articulates with the head of the radius to allow its rotation. The radial fossa is a shallow anterior depression just above the capitulum. It articulates with the head of the radius during flexion or bending of the forearm. The trochlea is a spool-shaped process located medial to the capitulum. The trochlea has a more triangular shape and is more pointed, not curved like the capitulum. It articulates with the trochlear notch of the ulna. The coronoid fossa is an anterior depression that articulates with the coronoid process of the ulna during flexion of the forearm. The larger and deeper depression on the posterior side of the humerus is the olecranon fossa. Because of its size and depth, it makes for a great landmark to identify the posterior side of the bone. It articulates with the olecranon of the ulna during extension or straightening of the forearm. The medial and lateral epicondyles are rough projections on both sides of the distal end of the bone. They serve as points of attachment for most of the forearm muscles. Notice how the distal end of the humerus looks like a hitchhiker's hand? The thumb on this hand is the medial epicondyle, and notice the thumb points medially, just like the head of the humerus. The first two fingers next to the thumb are the trochlea, the last two fingers are the capitulum, and the depression in the middle of the palm is the coronoid fossa. Another area you can palpate is the region right above the posterior surface of the medial epicondyle. This is the ulnar nerve, and this is the nerve that causes you to feel a sharp pain when you hit your elbow, also known as your funny bone. Hello, this is Rob Swatsky from the York campus of Harrisburg Area Community College in York, Pennsylvania. And in this podcast, I'm continuing my review of the appendicular skeleton with the bones of the forearm, the radius, and the ulna. The ulna is the largest of the two forearm bones, and it's located on the medial side, which is your pinky or little finger side. It's easy to remember because the ulna resembles a crescent wrench in the lateral view. The radius is the smaller of the two bones, and it's located on the lateral side, or the thumb side of the forearm. When you observe the bones in their side-by-side position, you can see that the ulna is wider at the proximal end at the elbow and narrows towards the distal end at the wrist. The radius is just the opposite. It's narrow at its proximal end and wider at its distal end. Okay, let's look at the bony landmarks of the ulna. The head of the ulna is located at its narrow distal end. It articulates with the carpals, but is separated from those bones by a fibrocartilaginous disc. On the posterior side of the distal end is the styloid process. This is a small spine-like bony projection that serves as an attachment point for the ulnar collateral ligament, connecting it to the wrist. On the proximal end of the ulna is the olecranon, which is the hard bony process that forms the elbow. The olecranon is also called the olecranon process. The olecranon articulates with the humerus by hooking into the olecranon fossa, a deeper depression located at the distal end of the humerus. On the anterior side of the ulna, we'll find the coronoid process. This projection hooks into the coronoid fossa on the anterior distal humerus. The coronoid fossa is a much shallower depression compared to the olecranon fossa. The trochlear notch is the larger curved area shaped like the letter U, which identifies this bone as the ulna. It's found between the olecranon and the coronoid process and forms part of the elbow joint. It's named after the trochlea of the humerus, the tooth-like process with which it articulates. Located just lateral and below the trochlear notch is the radial notch, which articulates with the head of the radius. There is a rough, bumpy area called the ulnar tuberosity located inferior to the coronoid process. It serves as an attachment point for the tendons of the biceps brachii muscle. Okay, now let's examine the bony landmarks of the radius. The head of the radius is located at the proximal end of the bone. It has a round disc shape that resembles a slightly warped hockey puck. The round head of the radius articulates with the capitulum of the humerus as well as the radial notch of the ulna. Just inferior to the head is the narrow neck of the radius. And just inferior to the neck is the radial tuberosity. This is a rough patch of bone that also serves as an attachment point for the tendons of the biceps brachii muscle. The radius widens at its distal end to form the tooth-like styloid process on the lateral side, which you can actually feel just proximal to the thumb. The styloid process is an attachment point for the brachioradialis muscle, as well as the radial collateral ligament to the wrist. The elbow joint is formed through an articulation between the humerus and the ulna and radius. The elbow joint has 2 points of articulation. One is where the trochlea of the humerus articulates with the trochlear notch of the ulna, and the other is where the round capitulum process of the humerus articulates with the head of the radius. I'll be reviewing the other articulations between the radius, ulna, and wrist in a future podcast on the joints. Hello, this is Rob Swatsky from the York campus of Harrisburg Area Community College in York, Pennsylvania. And this is the first of a series of podcasts reviewing the bones and bony landmarks of the appendicular skeleton. And in this podcast, we'll be exploring the bones of the hand, including the carpals, metacarpals, and phalanges. There is a total of 27 bones in the hand, which are organized into 3 groups. The carpals, or the wrist bones, contain 8 bones. The metacarpals, which make up the palm, contain 5 bones. And the phalanges, which make up the digits, or fingers, including the thumb, contain 14 bones. Let's begin with the carpals, which are the bones that make up the wrist, or the carpus. These most proximal bones of the hand consist of 8 pebble-like bones that are clustered together within 2 rows, with each row containing 4 bones each. One way that you can remember that the carpals are the bones of the wrist is the phrase, "Carpenters use their carpals." The carpals are arranged in 2 rows, the proximal row and the distal row. The carpals in the proximal row articulate with the ulna and the radius to form the wrist joint, while the carpals in the distal row are those nearest to the metacarpals. As you're learning to identify the carpal bones, remember that your thumb is on the lateral side of your hand, and your little finger is on the medial side of your hand. The carpals are named after their shapes, and we'll use this information along with a few other points about their position and other features to help remember their location. In the proximal row, starting from the lateral side, our first carpal is the scaphoid, which means ship-like. Our second carpal is the lunate, which means moon-shaped. Our third carpal is the triquetrum, which means 3-cornered. And our fourth and most medial carpal bone is the pisiform, which means pea-shaped. The scaphoid is sort of curved like a ship's hull, and the lunate is round like the moon. The triquetrum is the third carpal bone in the proximal row. Remember tri for 3. And the pisiform is a small, round, pea-shaped bone. The carpals of the distal row begin with the most lateral trapezium. And a trapezium is a 4-sided figure where no 2 sides are parallel. Our second carpal is the trapezoid. The trapezoid is also a 4-sided figure with 2 of the sides being parallel. Our third carpal is the capitate, which means head-shaped. And our fourth distal carpal and most medial is the hamate, which means hooked. The geometric shapes of the trapezium and trapezoid are pretty difficult to see. I would remember that the trapezium is under the thumb. Another way to remember the order is the last letter of trapezium, which is an M, as in Mary, and the trapezoid, which is a D, as in dog. MD. You call the MD if you happen to break your carpal bones. The capitate is the largest of the carpal bones, and you can see how its round head articulates with the lunate in the proximal row. You can tell the hamate by its unique hook-like process found only on the anterior side of the bone. The carpal tunnel is an interior space created by the pisiform and hamate and the scaphoid and trapezium. This space allows passage of the flexor tendons of the fingers and thumb, as well as the median nerve. With repeated use, these tissues become inflamed, which reduces the size of this space, which leads to carpal tunnel syndrome. Just distal to the carpals are the 5 metacarpals, which are located in the intermediate area of the hand. Each metacarpal consists of 3 parts: the proximal base, the intermediate shaft, and the distal head. The base forms the carpo-metacarpal joints with the carpal bones. The heads of the metacarpals form our knuckles, as well as form the metacarpophalangeal joints with the proximal phalanges. The metacarpals are also numbered Roman numerals 1 through 5, beginning with the lateral thumb, number 1, and ending with the medial little finger, number 5. The phalanges are the bones of the digits that make up the distal parts of the hand, and like the metacarpals, they're also numbered Roman numeral 1 through 5, beginning with the lateral thumb. One individual bone of the phalanges is called a phalanx, and each phalanx consists of a proximal base, an intermediate shaft, and a distal head similar to the metacarpal bones. The thumb, or pollex, consists of 2 phalanges, a proximal and distal phalanx, where there are 3 phalanges in each of the other 4 digits. Between each of the phalanges, we have articulation through the interphalangeal joints.